one of the differentiations is that when somebody's kind of feeling inferior or one-downing themselves, they're going to be deeply concerned about their impact on people around them. When narcissism is a big part of the picture, people have a very little concern or interest, and generally their behaviours, impacting on the people around them much more than it's impacting on themselves. But one of the things we were talking about, and it's because it is so talked about at the moment, is just being aware of when we talk about narcissism or a person being a narcissist, we actually want to bring in some grading. Because you can actually you need to have a little element of healthy narcissism where not superiority, but at least making sure that you're not getting stuck in inferiority. So that's where it can actually be, something that people who've got very low self-worth might actually need to bring in a bit of healthy narcissism to at least bring themselves up to an even place. Then we've got narcissistic traits. This is where a person is generally relating to people in a way that's not harmful or hurtful, but that at times, particularly if they're stressed or if they're hurting, their behaviour is going to get that real narcissist. They're going to go to that place of grandiosity or superiority to deal with whatever's hurting them. And then we've got people where it is much more an innate part of their personality. It's there all the time in all of their relationships. Malignant narcissism. And then we want to go across. So, malignant narcissism, this is the people who are actually really doing the manipulation, really consciously choosing to harm other people. And that's got a real aspect of psychopathy into it as well, the antisocial side of things, as well as the...
What is covert narcissism?
This is where a person is presenting as very charismatic, very caring, very interested in people around them, and apparently empathic. And then you start to notice that they're mainly kind of helping when it suits them, and that it is very dependent on how a person then responds. They'll be very quick to change in their response. So overt narcissism is where somebody's quite oblivious to other people around. Covert narcissism is where there's that veneer of behaving in a way they're presenting to others as having that empathic caring
I wonder
aspect.
if the next DSM surely will be reworking the personality disorders.
So just to describe, DSM is our Diagnostic Statistical Manual. There's also the ICD, which is used in Europe, but they're both where a group of experts in the area get together and work in meetings over weeks to months trying to develop a list and then putting them into the manual. Our last DSM was DSM-5, and that was in 2013, which is a long time ago.
Victim mentality.
And there was a real... Narcissists will absolutely, it's always everywhere, very much put that responsibility. But getting back to DSM 2013, there was a real delay in DSM-5 coming out because,
and it's old now.
Particularly, there was a real difficulty getting consensus about managing the whole area of personality disorders. There was a big cohort of people who actually don't want to continue to use those labels.
This is an interesting question from Happiness. Can a person change from being a narcissist?
Oh, thank you for asking this, because it's like BPD. People, in the past have been very much, no, they can't change. There's no therapy available for them. More recently, there's people who are starting to have a look at what therapies are available, what can help people change. It is much more difficult when we're dealing with people who there's an advantage to the grandiosity. It's if you're depressed, you're much more likely to seek help.
If you're a CEO and you're a narcissist,
if you've got grandiosity, it's harder to let go of. But once they start to have a look at the impact it's having across their lives, yes, there are people who are looking much more in how can they help people.
If it looks like someone's a narcissist, but suddenly all of their personal relationships are falling to the floor, that might be a moment where they can look inward and make some changes.
I was reading recently, and I was really interested in that how much does treating people with narcissism need to be in a relationship, working within a relational way. So, a lot of the work we do is individual therapy, one-on-one, whereas do people, and dialectical behavioural therapy, DBT, which is primarily for borderline personality disorder, but it's very effective in a lot of different areas. It's got both the individual component and the group component. We're social creatures. You know, some of these things, it's about learning skills in relating and communicating, which happens best in a group therapy. But
Wait, if you do, so you do group therapy with a group of narcissists, or with narcissists and their partners?
one I was looking at was
They are
working
delusional. How can you
with,
get through?
um,
They
narciss-
are delusional.
with people with narcissism and their families.
And their families. Yes, that's smart. The families can be like, you are, and we see that you're an app.
Well, it's helping the therapist, and you know, it's where the therapists are giving very clear feedback about the person's behaviour.
Electric shock machines would work. Thank you so much for coming in and out. We love you. And don't worry about it. There is sort of an electric shock therapy at the moment that's used for major depressive disorder called ECT. It's very effective for major depressive disorder. Don't know if it's used on narcissists though.
Look, I think it's important, you know, part of emotional kind of intelligence and emotional regulation is really sitting with how these people can make you feel, but also being aware that the problem sits with them and their behaviour, and that they're going to have the same effect on pretty well everyone they relate to. Why are we talking over each other?
ADHD.
Yes, because we're wanting to share so much. We've got a lot going on, balancing the questions.
ADHD.
Trying to get the information out there, but yes.
It's a really interesting thing to see a group of ADHD people talking, because everyone's like,
And I think
It's
you'll
fun.
notice when we interrupt each other, neither of us get particularly stressed about it. We just
No.
talk topics. Next
No.
topic, let's talk on that one. So we're also working to try and